Warning, this content may be upsetting or disturbing to some audiences. The worm normally lives near the brain, but had somehow made its way into his eye. Medical professionals, what's the worst thing you've seen on the job? I'm an EMT, and some of the worst things I've seen are the atrocities committed at nursing homes. Just as an example, we picked up a guy last week to take to the hospital who had chewed down to the first knuckle on his index finger. When I asked why he had done this, he replied, "So I could get out of this place." I truly believe that nursing homes are the worst places to send the elderly. Care for your parents when they get older, don't send them to these places. Paramedic and ER trauma tech here. And I have a lot of stories. Had a guy come into the ER once who had not taken care of his wound dressings after being treated for weeping ulcers on his legs. He was a diabetic, and his dressings were to be changed once a day. He came in after 3 weeks of doing absolutely nothing. His bandages had basically molded into his weeping wound, which had grown at that point from his ankle to just below his knee. We had to get a little creative in getting those dressings off as they were embedded in him. I was tasked with the job. I soaked some sterile towels in saline and wrapped them around his dressings. After a long soak, I started to peel off the wound dressing, and after the first few layers I got into the good stuff. Smelled like rotten roadkill, enough to the point where even in the negative airflow room the entire ER stunk of rotting, rancid flesh. Yellow pus, skin, interstitial fluid, etc. started to leak and peel off with it. I had to politely leave the room on 2 occasions to stave off vomiting. After the entire bandage was removed, I later learned that he had to undergo a bilateral BKA surgery. I once saw a Muslim father swear off and claim to disown a 16-year-old daughter whose pregnancy test came back positive. It was a standard test prior to a radiology exam. No one, including the daughter, had any idea. Thanksgiving evening, an 18-year-old male came into the ER after being stabbed at the dinner table 3 times by his brother. Once in the abdomen, and twice in his left arm. He wasn't in much pain but looked like he was done with life. Kept saying how he couldn't believe his brother would do this to him. I have brothers that I'm really close to, really bummed me out. Had a 4 or 5-year-old girl crying and asking me what we were doing as I was giving chest compressions to her 37-year-old father who was coding. She was holding onto her mother's leg who was in shock over the whole thing. Codes are no deal at all, but when they're young, the family is present, and there's a young daughter involved completely unaware of what's up. It was the only code so far that's really stuck with me. Air Angels flew to our ER with a trauma patient who had been in a T-bone car accident in the boonies. It had been a long time since the accident and extrication had taken a long time. As the Air Angels were landing, they called the ER to let us know he was coding. I took off with a nurse and 2 paramedic students. As we are pulling this guy out of the chopper, we note a significant amount of blood loss just everywhere. We're in the elevator, our medic students are holding all our badges, stethoscopes and whatnot as the nurse and I had to give them all to them in order to approach the chopper. We're crammed in an elevator, pumping on a guy, with 2 flight nurses, my ER nurse, me and 2 medic students who are like, "What the hell?" We're tearing down the hallway, blood trailing, flight nurse pumping on the guy while my ER nurse gets an IO line in his humeral head, doing the standard and most likely ineffective code treatments, fluid, IV drugs, CPR, etc. We get him into the trauma room. Trauma MD, who is a prior SEAL and complete expert, starts assessment, confirms the ET tube, gets a chest tube in, gets a central line with the rapid infuser and then finally decides to crack the guy's chest. I've never seen someone's chest opened up, but basically you make a serious, and I mean serious, incision from armpit to armpit and then take 2 medieval-looking clamps and crank the chest open, complete with cracking sounds and everything. Heart, lungs, organs, liver, it's all there. First time I've been in a trauma room where I, as the medic, was like, and at that point the whole thing was so far out of my league that I stepped back and became the gopher in the room. Go get this, go get that. MD starts suctioning all around and the guy's internals are just lacerated everywhere. His right lung is messed up, his liver as we're massaging the heart and suctioning is just bleeding out everywhere, and after all attempts to stop any bleeding, get his heart back up and running, restore any pressure in his cardiovascular system, 18 units of blood later, the MD calls it. Afterwards, before the family arrived, which was for quite some time, we had the best hands-on anatomy lesson from our trauma MD since the morgue. The room looked like a murder scene gone wrong. The medic students, who everyone had kind of forgotten about, were standing there pretty excited, still holding the nurse and I stuff. A younger couple, probably in their 30s, Came into the ER and went to fast track as the male was complaining of a boil or cyst-like painful, swollen area on his scalp. I wasn't actually on shift for the first part of this, but as I was walking into the nurse's station to take report from the on-shift tech, I saw a doctor walking out of the room looking visibly ill with a urine cup in his hand, swiftly headed for a specimen bag. This was an MD in his 50s, who had been practicing emergency medicine in a level 1 trauma center ever since he was out of residency, likely 20 years ago, so he was no softie. The nurse who followed him out the door saw me walking into the nurse's station and quickly grabbed me and everyone else within reach to examine the cup before it was sent to pathology. Dr. S turned and said, "I've never seen anything like this." Turns out, what they thought was going to be a simple I&D procedure, incision and drainage. My favorite thing to be a part of, turned out to be a maggot extrication. From a dude's scalp. A live maggot. Incising a cyst, expecting some pus and blood, to find a live, wiggling thorny maggot, did a number on everyone in the room. Afterwards, it was thoroughly talked about and researched, and it was very obviously a botfly. Read about it. This couple had been somewhere in Belize and after some time back in Chicago, he finally came to ER. It was still alive in the cup, wiggling around and whatnot. It was messed up. Read about it and YouTube it for some good stuff. Young lesbian couple in the ER. One of them complaining of abdominal pain. One of them there for support. Standard pregnancy test prior to radiology exam, positive. Maybe a little funnier than the Muslim father disowning daughter thing. It went okay. Horrible parents who shouldn't have kids story. We had a young boy come into fast track with a laceration over his eye from running into a coffee table or countertop or whatever. Happens all the time. The lac ran along his eyebrow line and as we were getting him papoosed, the kid started going crazy. Per usual. No kid likes to get all bundled up and held down for sutures, but most parents do the standard holding of the hand if it's accessible, talking, comforting. You know. Parent stuff. These parents, not so much. As soon as the kid started bucking, they called a halt to the whole thing. Not only did they decide right then and there they didn't want an ER doc to be suturing a face because they knew it wouldn't be nearly as good as a plastic surgeon, this is a hit or miss assumption and doesn't at all hold up to the generalization, but they wanted to consciously sedate the kid so he didn't have to go through maybe 3 lidocaine shots before feeling nothing for the remainder of the suture process. While everyone was waiting on the plastic surgeon to come in, the MDs and RNs absolutely refused to consciously sedate the kid because it was so utterly inappropriate and risky, while the parents refused to have the procedure done while he was awake. It was communicated that the risks involved were respiratory arrest, allergic reactions, etc., and the parents still wanted to subject their little kid to that rather than have him be awake for a couple lidocaine shots. The plastic surgeon comes in, is dumbfounded, and after about 30 minutes of arguing, showing these parents literature on the risks, they had to do it. Everyone was absolutely irate. So, naturally, what happens? The kid goes into respiratory arrest and has a horrible reaction to the whole thing. Loses his BP, the entire room is flooded with RNs, MDs, etc. as they transfer him from fast track and into a real ER room to start working on him. Advanced airway is established over the hysterical crying of the mother and pleading of the father to do something. Honestly, I got washed out. We didn't mess around with kids. The highest level of personnel were in that room, so I don't know the ins and outs of what happened after the basics were taken care of. I do know the kid was a life flight to Children's Memorial Hospital in Chicago and he was tubed and unconscious on his way out. A pallet from Costco fell off a top shelf onto a dude's head. Despite a total collapse to one side of this dude's face where brain matter was noted on the floor, he still had cardiovascular activity and thus the medics couldn't call it in the field. It was messed up. And it didn't take long for the trauma doc to call it. Stupid EMS field rules, the guys shouldn't have been worked on. Bad enough that he had a pallet fall on his head, worse that his body was subject to CPR, airways, IVs and overall battery on the way to the hospital. One guy came in from the field after working on his carburetor. Now, I don't know anything about cars, but from the gist of the field report, which was hard to hear over the guy screaming bloody murder, when he was priming it or something, it had exploded on him due to some ignition source, possibly static, burning like 70% of his body as he caught fire under his car. The entire ER was filled with the smell of burnt hair and flesh and the screams of someone who was likely in the worst pain imaginable. Our field medics didn't put him out, which was addressed by the MDs later, but he was immediately sedated and paralyzed with some sucks and versed. That was likely the last thing he remembers as he was toast, I guess literally. When you suffer that much burned area, we may be able to keep you alive, but your chances of getting out of the burn unit alive approach 0%. I've been an RN for over 5 years. The story that sticks out in my mind is this elderly woman who had colon cancer. I was newly pregnant, very bad morning sickness all day long. She was on the verge of death and started vomiting the contents of her bowels. When the bowels stop working, the stuff can come up out of the mouth. We had to get a tube down her nose ASAP to start sucking the stuff out so she could no longer puke it and die in peace. Those are hard moments. Watching someone dying and you are almost physically unable to help them. And usually I pride myself on being able to handle the most disgusting of situations. Someone had to come in and help me, thank goodness, and we got the tube down her nose. Guy came in with severe abdominal pain. Turned out he had painful hemorrhoids which had led to him being too scared to take a dump for 1 month. He couldn't tolerate any of the normal treatment, laxatives and enemas, so he ended up being taken to theater where I, the most junior member of the on-call surgical team, had to claw out this monstrosity of a turd with my fingers. It was this dense mass about 4 to 5 inches wide that felt like hardened clay and smelled exactly how you might expect a bowl of poop that's been brewing for a month to smell like. Took a good half hour before I managed to clean him out, all while the nurses tried to stand as far away as possible and my seniors pissed themselves laughing at my horrified expressions. Mine is not a story of genitalia nor hilarious STDs, I'll warn you now. Both my parents are doctors. They were working on September 11, 2001 at military hospitals in DC. When the planes hit the supposedly less populated half of the Pentagon, there were hordes of burn victims. I was relatively young at the time, but their faces when they came home is something I won't soon forget. They told me about a burn patient who was literally covered in third-degree burns across his body. From behind the ears to his tear ducts all the way down to the soles of his foot. From what they recounted, he was absolutely silent when they brought him in despite in essence having the raw meat of his body exposed to air, something that should be excruciating. Skin, it turns out, is the biggest defense the body has against infection. Within 24 hours his body was covered in massive black bleeds and infected sores. He still didn't say anything, not even a moan, or so I am told, until he died. My dad is a doctor in the intensive care unit. One day he had a lady who was crossing the street when a coach bus ran her over. She was dragged for 2 blocks before someone stopped the bus. She came into the hospital missing like 80% of her skin and was disemboweled but conscious for the whole thing. Dad's a dentist. One night we get a call at home from the local ER asking if my father is willing to come in and deal with a patient because, well, they have no idea what to do with this woman. My dad is a rather stand-up guy, so goes and opens his practice to treat this woman. I go along with him and help set up the room. An ambulance pulls up and wheels this elderly woman into the clinic. From the get-go the first thing that hits us is the smell. Her face is bandaged up pretty well, and we can see blood seeping through the gauze and all down her shirt. Double gloves, double masks, my dad dives in. She has something penetrating her lip. It's mustard yellow, and has the consistency of rock candy. He plays with it a little bit, and a large chunk breaks off. What's attached is 4 of this woman's teeth, or rather, the decayed remains of her teeth. Apparently, this 78-year-old woman had never brushed her teeth a day in her life, and what had penetrated her lip was an obelisk of plaque. He continued to clean away what he could, but the plaque buildup was so massive that she had literally rotten away all of her teeth and most of her gums. One spot was abscessed clear down to her jawbone. To this day he kept the chunk in a jar in his office, and scares little children into brushing their teeth every day. I keep telling him he needs to do a case study and submit it to a medical journal just for the lulz. Here's a story from my cousin, who's in med school currently. There was a PCP who went to some part of Africa, I don't remember where specifically, sorry, for the Peace Corps. When he came back, he found he was always more tired than he was when he left for Africa. One day he felt a pulsation in his eye and went to the ER. Once there, the doctor found a small worm wriggling around in his eye. The worm normally lives near the brain, but had somehow made its way out from there and into his eye. The ER doctor hadn't seen anything like it and called in another doctor to come and look at it. By the time the other doctor got there, the worm had made its way back out of the eye. Cut to about a month later and the PCP feels the pulsation again, but instead of returning to the hospital, he decides to take care of it himself. He takes a needle and heats it up using the stove. He then puts it into his own eye in order to remove the parasite. Over the course of the next year or two, he removes, if I remember correctly, around 5 of the worms this way before feeling better, Saw a lady who had flown in from another country to have US doctors help with her breast cancer. She had a metastatic tumor on her arm that was the size of a bagel and smelled of necrotic tissue. Her chest wall was replaced by a tumor and you could see her rib cage. Her family got mad that we couldn't just cut the tumor off her arm. The whole ER smelled like rotten flesh. Happy holidays everybody. For those who were wondering, she was from South America and was fairly well off. She had doctors there, but apparently the family was pick and choose about her treatment, and it obviously had gotten way out of control. I saw this 13 years ago when I was in medical school, and it's still a very vivid memory. A woman came in with complaints of abdominal pain, screaming about how her baby was dead. Her record showed absolutely nothing about being pregnant. After having her change into a gown, the most ungodly stench filled the room. My doc began a pelvic exam, with me as a standby. I will never forget his face as he removed a pinkish-brown clotted mass, a chicken leg. Turns out her baby was an uncooked chicken she chopped up and inserted into her vagina. Her baby might not have been dead, but that chicken sure was. Most disturbing thing I can remember in recent history was someone with cysticercosis, tapeworm infection, of the brain. I got a script for a dewormer with a ridiculously high dose. I called the doctor thinking it was a mistake and he told me what was up. We both agreed there was very little chance of it working, but he said there were absolutely no other alternatives. Worked on a rural EMT team during summers off from college, and responded to a drunk driving accident. When we arrived, I thought clearly this guy has to be dead, mostly due to the crumpled car that the firefighters had cut apart. This guy must have been drinking a lot, because there were beer bottles all over the place, with broken glass shards all lodged in his skin. But that wasn't the worst part. He had the remnants of a beer bottle lodged in his neck. Which in and of itself wasn't too bad, I've seen worse. Except the bottle was the only thing keeping his head attached to this body. The man had decapitated himself. I'll never forget seeing his eyes moving and mouth attempting to speak, or the sick sucking sound that were emanating from his neck as he struggled to breathe. Obviously, he did not survive the night. My wife worked at an ER in Dallas, Texas for a while. While she has many stories of mutilated bodies, burn victims and gunshot wounds, the one that got me was this one. A kid, about 13, and his mom come into the ER. The mom had dragged the kid in because he was complaining of real bad digestive problems. The kid had convinced her he was fine, until he couldn't hide the bleeding coming from his anus. They take him in for x-rays and see, clear as day, a 14 inches black rubber penis, like in that movie. They didn't know it was black then, found out later, obviously. This thing had wedged itself up far, most likely due to his efforts to remove it, was pushing on the walls of his intestine and had 3 days worth of stuff piled on top of it. They take him into a private room and ask if there is anything he wants to tell them before they discuss specifics with his mother. It's going to need to be removed surgically. He tells them no, he just felt sick. They tell them they had found an object lodged in his lower intestine. His response, "Oh, I may have sat on a marker." Poor kid. Just experimenting with that sexuality. With a black, 14 inches rubber penis. Student psychiatric nurse here. While on a ward for the elderly suffering from dementia, I had one experience I will never forget. I was helping a client eat, when I get a call from one of the rooms in the corridor. The client I was helping was pretty much done, so I went to investigate, hoping that it wasn't a fall as the call was from a room belonging to a very unsteady lady. Oh God, how I wish it were a fall. The lady who called, let's call her Betty, was in the corridor outside her room. The first thing I noticed were her hands, covered in feces. "Oh Betty, did you have some trouble in the bathroom?" Hey, it happens. Sometimes when you're older you may be a bit shaky or confused, and I'm not one to judge the unwell. Let's get you washed up then. We move into her bedroom when the smell hits me. For a second I just stare and try to take in what has happened. What follows is my brain process. Traces of feces are everywhere, on the walls, on the wardrobe, on her clean clothes, on her bed, on the door. That's okay, we can clean this. But I can't see any major, movement, from which it would have come from. But wait. There's something on the floor. As if someone had defecated on the floor and picked it up? Yes, there's slide marks from someone obviously move. Oh my God. She has shat on her dinner plate. I saw, on her bedside table, a plate piled high with feces, I'm not kidding, at least 6 inches, on top of the food. And I just stood there. And stared for what felt like an eternity, more like 5 seconds I guess, before calling someone to give me a hand. Perhaps it was a political statement about the state of the food in the hospital, I don't know. Regardless, I now have the best party and dinner table story. Another rockin' EMT here. We have the bizarre job of seeing crazy stuff in context, in the actual hovels and dumps and insanity people choose to live in. Or as the ones that have to scoop, and I do mean scoop, the sinuously attached bits of living people turned marionette attached by strings in order to get them to a hospital. Fun times. I don't talk about certain types of violence, abuse or torture I've seen on the job. Anthropologically, this is the distinction of sacred and profane horrors and trivialization, but here are a few things I've observed. Keep your feet in the freaking footwell in cars. Cars are engineered to crumple on frontal impact to help absorb damage before actually reaching you as the driver or passengers. Passengers, are protected by a stronger internal frame, designed anticipating that you'll actually sit in them with your feet in the footwell. I responded to an MBA, front impact with cement barrier, where a teenager in the passenger seat had her feet up on the front dash, seatbelt on. Resulted in lateral amputation of both legs when the car accordioned and her legs were driven into the plate of the car's hood. So instead of cutting a hot dog in half, it's like slicing it lengthwise all the way through. Folded her in half so badly her own body broke her hips and jammed into her upper chest. Miracle she lived. I got there and wondered how the hell to get a kid on something like that. Obviously ALS had to intervene and the entire seat was taken with her to the ED. When I drive, I can't have a passenger stick their feet on the dash or out the window because I can't help but think of how liquid that girl was. That key defense does work in self-defense classes when they tell girls to keep their keys out as they walk to their cars so they can jab for the eye if an attacker pounces. A guy came into the ED. Although you have to be 18 to be an EMT, I started my clinical training at 17, so underage I had to do a lot of ed work before getting out into the field, with a key stuck in his eye. Fun fact, your eye has extraordinarily strong muscles, and while you can jab it with something like a scalpel, the muscles will contract and can actually grip something like a key, albeit rarely. So okay, gross, dude with a key sticking out of his eye, but what was so grossly fascinating was that when he stumbled in and looked around, the key swiveled along with his eye in the socket, so you'd be able to tell if he was looking at you from how the key was pointed. Kind of obvious when you think about it, but it was very weird to see. Turns out he attacked a girl, she keyed him, then he ran to an ED lying that he was drunk and fell on his wallet keychain. If you start playing with a dead animal, don't forget where you put it. Call to a woman's house and the stench is unbearable. Isn't it always? She's not altogether there, and has numerous health problems from not taking care of herself. What weirds us out is that most of the smell isn't even coming from her, but somewhere in the house. I'm really worried there's a dead kid in the house. Don't ask that story. My partner checks a sunroom off to the side and there is a liquefied deer carcass in the middle of the carpet, with all sorts of new biology swarming around it. I see bits of hoof, that's how I guessed deer. We ask her about it and she starts giggling, all happy that we found it. Apparently she found a dead deer and thought it was soft, so she brought it home, but then forgot about it. It had to have been there for months. There are always the requisite overweight person's skin flaps are infected, or look, not showering, can, in fact, make you a little biodome for the brave new world of maggots, and the always popular seriously? How'd you fit that in there? Including such cameos as a Snapple bottle, light bulb, a pair of baby sneakers, etc. You know you're jaded when you see an entire orange in a guy, and the first thing that comes to mind is if only he'd peeled it first. I wonder if he could have absorbed any vitamin C. My favorite is when a patient looks you straight in the eye, trying to keep a straight face while telling you I fell on it, or I have no idea how that got stuck there. But I'll leave you with one more, a sentimental first aid tale. Try not to have a bad trip around hardware equipment. My first day in clinical rotations when I was a 17-year-old girl still in high school, my second patient ever was a guy wheeled into the ED who had, and was still having, a bad acid trip. He kept screaming how the canvas people bit him, and so he tried to cut off his own arm with a jigsaw so he wouldn't get infected. Mind you, jigsaws are not very sharp, so that was a dedicated saw job right there, but the bone was cut through, inexplicably, and his arm was only attached by a few sinews. He was still freaking out in the hospital and kept trying to fight the guys trying to sedate him. As my first day I was told to just stand back, not really trained to do anything at all, which I did. Acid guy lurches to the side and punches one of the paramedics in the face with his good arm. A male nurse ran to get some sort of sedative so they could strap him down, leaving his other side free, so he lurches again to punch someone else, swings around, and his loose arm flailed off. I won't say it flew off, because arms are very heavy, it kind of wumped off, right at me, and not knowing what else to do I caught it, took the full splay of it, and looked like Carrie on prom night. Actually he'd lost most available blood but I was still splattered like a Jackson Pollock painting. They sedated him, rushed him away for severe shock/blood loss treatment and surgery. His arm could not be reattached because of how badly it was cut off, and he woke up the next day claiming he didn't remember any of it. Imagine waking up and your arm is gone. Anyway, that's not my most gory story, but was on my first day on the job, and catching a huck, loose limb, is not common, despite what Grey's Anatomy and all that crap have written into their scripts, so it's definitely one that sticks with me. Thanks for listening to Radio TTS. Leave a like if you enjoyed the video. Well, that sounds weird. Leave a like if you made it till the end of it. Hit the subscribe button if you like this kind of content. And please share your own medical story in the comments below. Have a great day and see you soon.